Yeah, dear medicos, very good evening. We are having the privilege to have Dr. Punya with us, rank 33 INICET examination. So, but after this success, how you're feeling now?
I'm feeling great. I'm feeling amazing. Thank you.
So we congratulate you on the behalf of DAMS family for this achievement. And we will be
Thank
using this platform to discuss like what was your strategy and what was your approach for this INICET examination. So my first question will be better like when you started your preparation.
I had started my preparation for NEET and INICET in my third year of MBBS. So that was the lockdown year. And then 3 years, the third year, the last final year, and the internship, I prepared for NEET. And between NEET and INICET, I had tried to prepare for INICET in the last few weeks. Right.
Starting from the third year, like third year you started your preparation. So what was your approach in the third year? Like I'm giving you the option, you choose the option. Like let us play like you're going for MCQs. The first was you focus on basic sciences with less focus on the final year subjects. You start repeating your patho-micro, or the second option was you just concentrate on the final year subjects.
So then third and the final year, I focused on my third and final year subjects only because I thought that that was what was going on in the college anyway. And we had to attend the rotations of those subjects as well. So that's the time I focused on my third and final year subjects. And during my internship is when I started to focus on the first and second year subjects.
That's very nice because many students, many medico have this type of questions. Okay, like we didn't study in the first year, second year. So when we start our preparation in the third year, what should be our approach? We should go for the second year subjects or final. And even I believe if we should focus on the third and final year subjects, and the internship time can be used for your basic sciences.
That's
Coming
true.
on the importance of basic sciences, what was the role of patho, micro, pharma in this rank 33 Veda?
So in INICET, I felt they form the major chunk of preparation, the basic sciences. They tend to ask a little more on the basic sciences than NEET is what I felt. And doing them in a little depth actually helped me for INICET. And even the concepts, even during the first, second year of my college, I had focused on the uni, although I had not prepared for my NEET exam. So even those concepts, actually, the few practical questions that they ask, etc., actually helped me. When I had read about my university examination, those concepts helped me even in this examination. So I felt the basic sciences do have a role to play, especially in INICET.
And importance of self-written notes, like in third year, you were making your own notes.
Yes.
How they help
Yes.
in the last spell, like the 2 months before the examination? What was the role of your own self-written notes?
I think that is very important because when you have the last 2 months, you need some place where you will go to and have the entire subject concise, and that is according to you. When you have made your notes, that is that the notes that you have made, those are compiled and consolidated according to your thought process and how you have understood the subject. So it becomes reading very easy when you read to the same notes again and again. And also the visual memory really helps if you use one source of notes and keep repeating them again and again. If you start to change your notes from one source to other, it really hampers your visual memory. A lot of the times you will not remember. You'll remember, oh, it was in this page, in this part, and that will help you open up your memory. So I think having that one set of notes and then revising them again and again really helps you. And at the end, they only ask the basics of all the subjects in any examination. So if you know the basics of all the subjects, and then if you just keep revising that again and again, it's very helpful for the day of the examination.
One most common question everybody asks, how many times you revise the notes?
So mine, actually, the number for me is a very, I'm not I cannot answer that very nicely because the thing is, I had in my third year only, I had done like that subject only at focus third year. So in that, I had revised once and then before the prelims and then before the finals, like that. I done from the notes only for my uni exams. Same for the third final year, I had given 3 revisions in that year itself. So for internship year, I just could give maybe 2 revisions of the entire course. So because I think the revisions I did in the previous years added up. And in an internship, I could just do like the first, second year once, and then revise the final years and the third years, and then one other revision of the entire course, like that.
So like we can say 3 to 4 revision required.
3 to 4 should be ideal revisions, yes.
Should be the ideal. In the internship, what was your strategy? You were adding some new points or the same point which you notes you have made, you focus on the revision segment. Quantity.
A couple of subjects I had started adding points and I realized it was a huge mistake because at the end you will the points you will add, you will never want to look at them again in revision. You want to cut short into the smallest possible. At the end, I actually, for all the short subjects, I just revised the DBT and gone for even the NEET examination, the DBT of DAMS, because at the end, the time really matters, especially when you are in intern. So in the beginning of a preparation, you get that FOMO of missing out on information from, different sources of what you're reading in the rotations, etc. So you want to add and make your notes more, bulky. But after giving grand tests, you realize they only ask the same important concepts again and again and again. For the same concepts, they will frame a different question. So for the last 2 months, you need that very filtered short set of notes, which you can revise again and again. So I think for me, at the end, retrospectively, I realized that quality over quantity is the way to go.
Very nice. And we are having the proud moment of having Dr. Punya with us, and she's giving very honest review, okay, how we should focus on the multiple revision rather than going for the quantity and adding all the points. Very true, beta. Now coming in the internship, like you appeared for our T&D, what was the experience of test and discussion?
Test and discussion is very useful if you for maintaining a schedule of a preparation in T&D. For me, initially I couldn't follow the schedule because I had my first, second year notes only to complete. But after that, I tried to follow the schedule. Or even if I couldn't, I found my own schedule. But I kept that as a deadline that after completing a subject, you can watch the T&D of that subject. And that also helps in compiling all the subject once, so you know that how much of a subject that you have understood. So that is very helpful. And plus the questions are also the questions also very similar to the NEET pattern questions. So if you do the INICET T&D, they're similar to the INICET type of questions. So that also gives you a very good practice for each subject to do the questions which are targeted for that examination.
Where you rate better, like if you compare the difficulty level of your INICET against your T&D?
INICET against the T&D, I felt the T&D questions were a little one notch higher difficult than NEET. So I think it would be equivalent to the INICET paper. And the concept as well also but actually this NEET exam were also pretty one notch higher than maybe the previous NEET examination. So I think it would be very comparable to the NEET and INICET type of paper, the T&D questions.
And coming on the after appearing for T&D, you appeared for DBT. How was the experience of those days with a DBT live session?
DBT experience I really enjoyed. Actually, they were one of the fondest memories of my, at the end of my internship days, because it was I had attended the live, we had a DBT screening in our city, Baroda. So all of we had a very good group. We used to study together, and we all of us attended the DBT also together. It was very good because it had that specific days and it completed the DBT in 1 week. So, because I am a major procrastinator, so at home I, tend to stretch out the course for a long time. So for DBT, it was very concise. It was 7 days. It was a very quick revisions of all the 19 subjects. And we were all watching it together. So we used to discuss in between, the breaks that, what, if you missed out any points, if you had some doubts and all. So it was a very fun experience, the whole day sitting. And it also, sitting for 13 hours in the last few months also sort of increased my capacity to study for a longer time after that. So the whole experience was really fun, and I felt it was really helpful even for the short subjects. I felt that concise notes, you should have one very concise notes ready, because at the end you always feel you'll read everything for all the subjects, but sometimes you are short of time and you cannot do anything about it. Like for me, there are 2 days and I had all the short subjects to revise. So for that, it was a boon that I had DBT with me. Otherwise, I would be, I don't know what I would have done in that time. So at least you'll get a quick revision of everything if you have a very short, concise notes with you.
Any special moment of DBT that click in the examination hall? Yeah, ye dikha rahe the aur ye pucha aapse.
Any short subjects, that was my only and the major source of preparation. So any questions from short subjects, I went back to the DBT and found most of the, actually all of the questions got covered from the DBT itself, the short subjects. I think except maybe just a couple of questions, that's it. And even for medicine, I felt DBT very helpful. For medicine and short is when I used DBT, because medicine I had understood very well in my final year, and in that time I had read the notes a couple of times. But in the internship year, I didn't have the time to revise all my notes. So in that, even doing a DBT was it's a so beautiful, concised medicine. And I added a couple of points in DBT only, which, PYQs, which I wanted to add. So that became my only sort of preparation for INICET also and for NEET also for medicine. So that was very helpful for me.
That's great. And what I'm getting from your words, the DBT was a game changer for you in the last spell.
It was really helpful.
Good momentum in the last spell. So now coming on the last segment, like PYQ, how was the experience of PYQ, the previous year question line?
Previous year questions are very important for both NEET and INICET. Actually, for NEET, I had done PYQs maybe twice, but for INICET, my major source was PYQs only, because after NEET I had got a little slacked off and started to stop preparing for a whole month. But after that I sort of tried to regain my preparation by doing PYQs. That's how I got back in the preparation for INICET. And I felt like focused mainly on that because then I was short of time. I just had a couple of weeks to prepare for INICET. So I just mainly focused on the PYQs, and the paper is very similar. The pattern of questions is very similar in INICET. Plus they repeat sometimes the same questions, or they repeat from the same topics. So I could understand which topics are focused, and only those topics I read before the exam. So PYQs are the way to go for any exam, I feel. Even if you don't do the entire Q bank, PYQ should be thorough.
That's very true. And like you are the best candidate because you got awesome rank in NEET followed by INICET. If I ask you, out of 19 subjects, which subjects are the core, are the game changer for?
I felt for me, I think surgery and ops for NEET, because I felt those subjects were very solvable, and if you do it well, they are pretty scoring. So for me, I think they really helped in NEET. And for INICET, I think the basics of biochem and path and pharmac, those were the subjects which they focused on in even PSM. But yeah, so the preclinical were, I think, the bigger focus in INICET, and the clinical subjects, they helped me in NEET.
And everybody was giving the feedback PSM was on the difficult side, was it?
PSM was. The PSM, a couple of questions were such that I felt that even if you prepared your best for it, you wouldn't be able to crack those. But except those, I felt there were a couple of questions that you would know if you read well. So those questions I could crack, but of course the ones which were, very tricky, and those which are not heard of, those everybody had left. So even I had left those questions. So those are never the rank deciding questions at the end. Those, very tough and very weird questions. Everybody leaves those questions. But in the basics, if you make a mistake, that can make or break your rank.
Very true, Beta. At the end, Beta, any special message for your family because of whom you are here on this platform?
They are actually my mom, dad, and my sister. All of them are ophthalmologists, and they are the only reason I'm in MBBS in the first place. And they've been a huge support system throughout my life and throughout this entire MBBS journey, because they've gone through this before. So they told me what to expect. They helped me out whenever I felt down, and they have been not only that source of inspiration for me throughout my life. My sister is just 7 years elder to me, so whatever she does, I blindly follow. So that has been such a big encouragement, motivation, support for my life. So that's the reason that I do whatever I do, honestly. So
you convey our wishes to them, and this is, I feel, this is their success. Like you're getting
definitely
some achievement in the NEET and as well as INICET exam. At the last, Beta, any special message for DAMS family?
I would really like to thank all the teachers, all the faculties, the institution of DAMS, all the people who go behind the tech, and everybody involved in such an institution, because they make the life of students so easy. My parents, being doctors, have told me in their time it was so difficult because they had to interpret huge textbooks and try to crack the exam. But right now, all we have to do is just literally in the click of our fingers. All the matter is ready. So many people put so much effort so that things become so easy for us to become better doctors, to get a better view of the subjects. Like if I was sitting alone with a Harrison, I know I wouldn't have been able to understand anything. But there are people who have done that work and have done that effort and have brought it down to just the important concepts for us. So I think that itself is such a privilege that we get to have, to for such people to work hard and give us the best knowledge that there is. So I would really like to thank everybody involved.
Thank you, Beta. Thanks a lot, and we are confident you will excel in your next spell of post graduation. Which branch you are planning to do?
Ophthalmology.
Chalo, best wishes, Beta. Thank you for coming.
Thank you so much.
Thank you.
Thank you. Thank you.